We are going to be giving an IV push medication and hanging some IV piggyback medication for our skills verification in this video. So let's get it started. I'm going to first perform hand hygiene. I'm going to ensure that I have all of the equipment that I needed for the skills. I have my pen, I have my med cards, I have my EHR tutor pulled up, I have IV tubing, I have my medication bin, and everything is in the order that I am prepared for. So I have my orders up here and I have my MAR up here. And so I'm going to make sure that I have verified that I have the right patient for my MedCheck 1. I have Miss Code Brown here, 61851 in my orders, Code Brown 61851, and in my MAR, Code Brown 61851. And I'm gonna first start with my IV push medication, which is ondansetron. So my drug is ondansetron. I'm gonna scroll down until I find that, found ondansetron. I'm gonna go over to my MAR, scroll down until I find ondansetron. So I have the right person, the right client, the right drug, the right route. This is gonna be injectable, which is IV push. So I'm gonna look over here and see that it says IVP, IV push, and then look over here. So that was the orders. On the MAR, it says injectable solution, administer IVP. So I have the right route. The right dose is gonna be 2 milligrams. So I'm gonna look on my orders to see if it's the right dose. It says 4 milligrams. So right now I am recognizing that I'm going to be giving twice the amount here. So we're gonna keep that in mind when we're drawing it up. So it's 4 milligrams on my orders. On my MAR, it says 4 milligrams as well. And so now we're gonna see what time is this due. On my orders, it says that it is due at 7:14. And on my MAR, it says that it's due at 7:14. And I'm gonna look at my watch here, which says 7:14. And so looking at my medication vial here, it says 2 milligrams per mil. And so if I'm going to be giving 4, I'm just going to double this and I'm going to be giving 2 milliliters. I did that math in my head. So I'm going to set that down. I have done, actually before I set that down, I'm going to check the expiration date. And it says July of 2030 and the vial is intact. I don't see anything impaired with it. I'm going to do the same thing here for MedCheck 1 with my IV piggyback medication, which is meropenem. And so I will ensure that I still have the right client, Code Brown 61851, Code Brown 161851, Code Brown 61851. On my orders, I'm going to find meropenem, and in my hand I have meropenem. Now my MAR, I'm going to scroll down to find meropenem. My route is going to be injectable infusion, IV. In my hand, it's what I have. On my orders, IV piggyback is what I have. And on my MAR, IV piggyback is what I have. The dose is going to be 500 milligrams per 50 ml. On my orders, it's going to say 500 milligrams. And then on my order, it's going to say 500 milligrams. So we have the right route, dose, medication, and the right time is going to be given at 7:14 a.m. And then that's my orders. On my MAR, it says 7:14 a.m. Click more details, and I'm looking at my watch. It says 7:14 a.m. And the expiration date for this medication is going to be May of 2028, and I'm looking to see if there's any particles, any leaking, and this looks good as well. So I have now completed my MedCheck 1. I am going to minimize my orders, open up my MAR here, scroll up to look at the name again. So my med bin says Code Brown 61851. I have Code Brown 61851. I'm going to pick up my first medication. I'm going to scroll down until I find what I have on my hand here is ondansetron. I have ondansetron. I have an injectable medication. It says injectable medication. This says 2 milligrams, which is what I have on hand, and what it's ordered is for 4 milligrams. I can administer this. Time to be given is 7:14, and it is currently 7:14. And so we have the client, drug, dose, route, and time. So MedCheck 2 is done for that medication. I'm We're gonna scroll up. We're gonna double check. Code Brown 61851. Code Brown 61851. And I'm gonna scroll down because now I have meropenem in my hand. Scroll down, I have the right drug, meropenem. Meropenem, the right route is gonna be injectable infusion, IV. Injectable infusion, IV. The right dose is gonna be 500 milligrams. Got 500 milligrams. The right time is gonna be 7:14. It is 7:14. And then we are good to go with med check 2. So I'm going to prep my medication here. I'm going to grab a syringe with the needle attached there. I'm going to clean off the top of my medication. This in clear. I'm going to pull back the 2 milliliters because that is what we've done. Insert this in, invert it, add the 2 milliliters, ensuring that we don't get any bubbles of air. Drawing up, adjusting as need be. So we are comfortable. Pulling this out, we're going to properly recap this needle. Okay, set that off to the side. This is ready to be given. And I'm going to take my IV piggyback. I have brand new tubing here. I'm going to make sure that this is clamped all the way down. Then up. Set that in. Just squeeze my chamber. Upside down, ensure that is halfway, making sure that I am not going to spill this when I am crumbing my line. Opening this up nice and slow, ensuring that there's no bubbles getting through. Okay. And I'm going to clamp that off both spots here. Okay, my medications are prepped and ready to go. Hi there, my name is Sadie. I am one of the instructors here with CVCC, and I am here to give you some medications, and later on we'll be discontinuing your IV. So I've closed the door here for privacy, and I'm going to perform hand hygiene. Can you verify your name and date of birth one more time for me again? Thank you. Code Brown 61851. I'm just going to double check that over here. And Code Brown 61851. Okay, and tell me again, do you have any allergies to anything, and you're not sensitive to tape, correct? No allergies, not sensitive to tape. Okay. And I'm just double checking that is in the system, no allergies. Okay, so let me explain to you a little bit more about these medications that I'm going to be giving. So I just looked at your vital signs, and it looks like you developed a little bit of a fever. So your last temperature was 101.9, and your heart rate's a little bit elevated. It went from the mid 80s to the low 100s. And so we're a little bit concerned that you are battling a bacterial infection. And so we are going to be giving you an antibiotic. It's called meropenem. And with this medication, I'll give you a little bit of education. It's an antibiotic that is used to treat bacterial infections. And a couple things that I want you to watch out for, not to be worried too much, but to keep an eye out for these things. They do occur, but they can be rare, is that they can cause seizures in people that are prone to seizures. It can also cause some confusion. You can also be sore in your mouth. And so if you feel any of those things come on, I want you to call your call light and come in and let me know immediately. The other medication that we are going to give you is that new development that you let me know earlier today of nausea. This medication is called ondansetron. This is going to help with that nausea. And so we will be giving you that first. So that's going to give you some relief. And so some of the side effects that can occur with this is you might feel a little bit of chest discomfort. If it does develop into any sort of chest pain, I do want you to let me know immediately. And you may feel a little bit of blurred vision. And if it starts to get too worrisome, again, just let me know. But those are some side effects that can occur. So do you have any questions about what we are doing at this time? I've reviewed your other vital signs and everything else is looking okay. So this is, you know, the route that we're going to be going down. Your labs are within normal limits. We did take some blood cultures, but those won't result for a little while. So I'm going to go ahead and get started here. Let's do med check 3. I have the patient code brown 61851. I see here code brown 61851. The first medication is ondansetron. I'll scroll down in my file until I find ondansetron. And I see ondansetron. The dose that I have on hand is 2 milligrams. It is ordered 4 milligrams. And I have 2 milliliters pulled up. The route is IV push. The route is IV push. The time is to be given is 7:14 in the morning. It is 7:14 in the morning. So I am good to go with our first medication. The second medication is the meropenem. And so we'll double check. We've got code brown here, 61851. I'm going to scroll all the way back up. Code brown 61851. I'm going to scroll down to meropenem. I have meropenem in my hand, meropenem here. The dose is 500 milligrams. I have 500 milligrams. This is an IV piggyback. We have IV piggyback to be given at 7:14 in the morning. It is 7:14 in the morning. Third med check is done. I'm going to go ahead and scan the patient's wristband. Okay, we are going to scan the wristband. Scan the medication. And while I'm looking to make sure everything is been flowing well with your regular primary fluids, looks great, I'm going to clamp those off. Okay, so that is clamped. So the port closest to the body, I am going to clean very thoroughly, clean, and we are going to take a flush, and we are going to flush this through, looking for signs of infiltration and inflammation, making sure it's still painted and good to go. All right, that looks great. I'm going to remove that, set that off to the side, and I'm going to grab a fresh alcohol pad and I'm going to clean. That felt okay. All right, grab up our medication, remove this needle, which will go into the sharps bottle. Now I'm going to take about a minute infusing this. So I'm going to watch my second hand and we're going to go nice and slow because certain medications you don't want to go too fast. Some medications are very specific on how fast or slow that you administer these. And so a minute has passed. To remove that, and I'm going to clean this again, and I'm going to grab another flush, and I'm going to flush this at the same rate that I gave that medication. Okay, time has passed. All right. So you should be feeling some of that nausea dissipate here shortly. All right, now we are getting ready to hang our piggyback. So I'm going to remove our primary bag, and this will now go on the hanger to be lowered, and this will go above. I'm going to clean the port closest to the top here, and I'm going to unclamp and unclamp, And then I will unclamp the primary tubing and unclamp the primary tubing. And this should be flowing nice, looking for signs of inflammation, infiltration, patency. And so we've got this flowing nicely, dripping well. The rate of 100 mils per hour. I'm gonna remove my gloves, and every time I do that, I will perform hand hygiene and then get ready to document. Okay, to chart, we are going to chart that it's given. I'm gonna change the time here to 7:14. The dose that we gave here for the meropenem is 500 milligrams mg. And the rate that we gave it was 100 mils per hour. The location was in that left forearm. Pertinent clinical data, there's nothing I needed to have for this particular information. No comment, no nurse witness. Second medication, that ondansetron, I'm going to change it to 7:14. The dose was actually 4 milligrams, well, it was 2 milligrams per mil, so it is 4 milligrams is what I'm going to give. Okay, see how I changed that to what it said there? And I'm not giving a rate because it was IV push. And then we are going down to find the left forearm again. No clinical data, no comment, no witness signature, and update chart. Okay, I have documented, I have cleaned up my area, the infusions are going. I'm going to head and move the client into a safe position, ensure they have the call light and side rails are up, and I'm going to exit the room and pretend like the time has passed and their infusion is complete. Knock, knock, knock. Hello. I'm gonna close this door. It's me, Sadie, again, the nurse that's been taking care of you today. I just want to verify your name and date of birth again. All right, Miss Code Brown, 6/18/51. It looks like I see that your medication has been completed here. You have finished. We are going to go ahead and discontinue that for you. I'm going to go ahead and give myself some hand hygiene here. And I am going to take off the medication and remove the IV altogether, which is very exciting. I'm going to verify that we have an order for that first. So I'm going to pull over into my computer here, going down to the orders, and ensuring that at the top it says Code Brown 6/18/51. I see discontinue IV for today's date at this time. I am already going to open up my flow sheets to the interventions, lines, and drains because I will be charting this removal next. So I am going to put on gloves. And I'm noting the site. How does it look? Is there any pain, redness, anything along those sites? I have gauze and I have tape. I'm gonna get that tape pulled up and ready to go. Make sure everything is clamped here so that we don't have any excess fluid running off on me. And I'm going to carefully peel off this medication or this transparent dressing. Okay, I'm going to grab my gauze, place it on the site, pull this out, and I'm going to inspect this catheter and make sure that the tip is intact and prepare that for the proper disposal. My tape. Place that on nice and secure. All right, and I'm going to dispose of my medication, lines, remove my soiled gloves, perform hand hygiene. And I'm going to go in here to do my charting. Okay, so I'm in interventions, lines, drains. I'm going to hit add This type is going to be peripheral IV. The action is going to be removal. The location is the forearm. The site orientation is left. We don't need to prep. We don't need to size, insert, intent, patient response, tolerated well. Site assessment can be clean, dry, intact. Infiltration, none. Phlebitis, none. The dressing type was, we used gauze and transparent. It was removed by me. And the removal reason was there was an order to DC. And then you're going to come up and hit save. And it should be good. All right. I am going to put the bed back into a safe position, ensure that you have your call light. It's a pleasure taking care of you today, Ms. Brown, and I hope that you have a pleasant recovery. And if you need anything at all, just please don't hesitate to ask. You can never do too much hand hygiene.